would like to introduce, and it's my proud privilege to introduce our lead facilitator, Dr. Prashant Kumar. Sir is a professor, Department of Anesthesiology and Critical Care, Pandit B.D. Sharma, PGIMS, University of Health Sciences. Sir has wide experience and interest in neuroanesthesia and neurocritical care, airway management, medical education, COVID-19 research, and most importantly, simulation and skill training. So we hope everyone will benefit from Sir's experience. So now I welcome Sir Dr. Prashant Kumar, who will speak on importance of simulation in COVID-19. Thank you.
Good morning, all. It's really honor to be here in this workshop, which is first of its kind, and it's being done under the guidance of Shri Sunil Bartwalji, Mukmeet Singh ji, and obviously Dr. Das, who is in the center, who took the lead and planned this kind of workshop. And this kind of workshop is very different and important in terms when we talk about simulation and we talk about COVID. These two things, they go hand in hand now, because the COVID has taken our the normal teaching routine, normal training routine at a very good loss. So when we talk of simulation in medical fields, what we need to understand, we need to look at ethics. And in ethics, the part is bioethics. In bioethics, there are 4 pillars for the patient care, which are the autonomy, beneficence, non-maleficence, and justice. Out of these 3, the most important one, the non-maleficence, which is do no harm, is the crux from where we come from the simulation. And to do that, we need to understand that there is nothing new in that. It has come to us from father of modern medicine, Hippocrates, that physician must have 2 special objectives in view with regard to disease, namely, and to do good and to do no harm. So there is nothing which we are projecting here, but the ancient thing which was there in our medicine has come up now to the field where we need to use more and more of simulation for training. And simulation is needed because the COVID has taken a lot effect on our education, be it in a medical student education, be it training of our staff, be it the training of skills. And there is a very good quote which I have taken from the blog of Michael Levitt, who was former Secretary of Health and Human Services in US. And he talked about, and he said that everything we do before a pandemic will seem alarmistic, but everything we do after will seem inadequate. And there is a story behind it, that if we look at the fire in a forest, so what happens? If fire in a forest is spread so rapidly, and it takes from one tree to the another tree, and who are affected? The small animals of the jungle only, they are affected. But if there is a provision, if there is a forest where the trees are spaced apart and there is a gap between the trees, that fire won't be able to spread rapidly and destroy the whole jungle and all the trees. Probably the corona is also working in the same manner. So another thing, example from a humor part can be taken why simulation is needed, that most of the time what you need to look for the doctors is that they are, surgeons are having blood on their scrubs, anesthetist is having coffee in their clubs, and these kinds of cartoons, they come up for all the kinds of doctors. But any kind of doctor who's serving what we require as a healthcare staff, for the doctor, for our staff, for emergency staff, for paramedical staff, for the paramedics who are bringing the patients in, that with the ring, there has to be immediate action. And that comes from the theory that there are hours of boredom, but there are moments of terror. And to do that, we have to be actively prepared. To err is human. We all are human. We have something given to us that we may do any errors. Okay. But medical field, when the errors are, we need to look for preventable medical errors so that they do not happen. To do that, what we have learned is see one, do one, teach one. But what has happened that the practice of see one, do one, learn one is no more available to us. Especially there are psychological effects, there are behavior changes, and there are stressful conditions. So simulation is nothing but act of mimicking a real object, event, or process, and it is another tool in our education range. So it is similar to our lecture, case discussion, skill labs, MCQ, all kinds of activities which we already do. But it has got some advantages with some different components. You can do it with standardized patients. You can do it with screen-based simulation. You can have task trainers, or what we generally comes to our mind when we talk of simulation are the mannequins, which we will talk about today. Simulation has largely been copied from aviation industry. But looking at the aviation simulation trainers, they have increased the safety and reduced cost of training. But to my experience to these simulators, my first experience came from the simulator for car training, from where the similar kind of simulator was there, and you can sit into it and then you can start learning the driving. So before going to the car, you can learn it on the simulator. The similar principles are applied, and you apply it to the medical education. And when we look at the history of simulation, so the resuscitation movement came into around 1954-59, and while the simulators started coming up, first simulator was built in 1969, and from there on we are getting better and better simulation. The same has been shown as such in the growth of literature in simulation. But what advantages these simulators give to us are that there are gaps in our traditional teaching about the skills in challenging situation, inadequate practice, and all these things have been enhanced by the presence of COVID, where we cannot have real life patient to the teaching, plus the safety of the patient as well as his staff is at stake. While we talk of the simulation, we also need to talk about the fidelity, and fidelity is the extent to which the appearance and behavior of the simulator or the simulation match the appearance and behavior of simulated system. And to let you know that there are fidelities from low fidelity to high fidelity, but these fidelities, they govern the four things: equipment, task, environment, and psychological effects. And when we club these four, we can have altogether a different experience and situation by having the same amount of equipment and task training which we have. So generally, when we talk of simulation, like all the colleges are now being equipped with skill labs, and we'll have the simulation labs into that also. So it provides us the safe environment, and safe environment gives us permission to fail. So even if you fail, you are not afraid of that the patient will get harmed. There can be unlimited exposure to clinical situations. So even not for the rare clinical situation in terms of what we are already looking in COVID, these situations where we cannot take all the workers around, we cannot go as a group and look at the situation. Those scenarios can be created inside the simulation lab, and they can be reciprocated as many times as we needed.
Thank you so much, Dr. Prashant Kumar. Sir, we are enlightened with your talk on role of simulation in COVID-19 training. So for the next session, I would like to invite our own faculty in Department of Anesthesia, Dr. Anup Gogia and Dr. Mudit. Sir is Professor and Head Department of Anesthesiology at ESIC Medical College and Hospital, Faridabad. This session will be on PPE kit donning and doffing at ICU.
Thank you and good morning, everybody. You are most welcome to this beginning of this webinar. And ESIC Medical College and Hospital, Faridabad has taken this initiative to do some of the procedures live so that it can reach lots of people, and it is also for the training of our own health care worker, so that the problem which we are facing nowadays, if it magnifies, everybody should know what is to be done. So we will start with donning and doffing procedures in the ICUs. The donning procedure is basically done in designated areas. So this is our donning room. Few things which are very, very important in the preparation is that the person who is going to don this thing should go to the areas where he can take a meal, and then he should go for passing urine in the washroom, and also he should have enough of water, because after you have taken and donned the personal protective equipment, then you may not get your chance for all those things in next few hours. So after these things, he should come to the donning area, remove all the accessories like wallet, the pen, mobile, and everything should be removed by the person. And then he should have thoroughly washed his hands by soap and water before coming to the donning area. Then once in the donning area, the to do is to perform the hand hygiene with alcohol-based solution. Best thing is it is done through a automatic hand sanitizer, and then he will show you the 6-step hand hygiene, how it is done. So you rub your palmar surfaces, the nails, the fingers, the thumbs, and then the palmar surface with rotatory motion, and then up to the level of elbows, the sanitizer is applied. Then when after this hand sanitization, he has to wear his first pair of gloves. These gloves preferably should be sterile, but you can also wear examination gloves. And for wearing the gloves, as you can see, he's not touching any other surface, and the glove is put up to the level of beyond the wrist and deep in the forearm. So after wearing the first glove, he has to take out his personal protective equipment. The first thing is that he has to open it and examine it, that there are no breaks, and it is absolutely intact. Then he has to open it, unzip it, sit down on a clean stool or a chair. I'll prefer a metallic chair or a plastic one which you can use, so that which can be easily sterilized. Then first you have to slide the lower portion, Now the arms gently ease into it. There are different sizes, so it is imperative that depending on your size, you choose the proper type of personal protective equipment. Then you can zip it right up to the top. And cover it with the flap which is on top of it. Yes. The next procedure is to wear the shoe covers. For this, you have to sit down. Slide the covers, and it should be gently slided, and it should go up to your level of calves. Then you can tie it. If it is Velcro, you can just stick it in. Otherwise, if you have a tie, then best is to tie it. Now, the most important thing now is to wear the mask. This is the N95 mask. It is held like a cup in the hand so that both the fasteners, they fall down. Okay. Now you hold it in front of your face. Take the lower one first. Put it below your ear. Yes, like that. Tighten it. Then put the upper one above the ears. Tighten it again. What you have to do is to check if there is any leak all around it. It should be a perfect fit. So that is important. Yes. So you have to see there is no leak around it. Now take a face shield. Before that, you can put the hood over it. Yes. And now you can take your face shield. Ensure it is properly fitted. The final step now is to wear the second pair of gloves, which should always be sterile. Take it over your sleeve so that the sleeve is properly covered by the sterile gloves. Yes, so he is now absolutely ready to go inside the ICU. So this finishes with the donning procedure. The second part of this talk is doffing procedure. Doffing is again done in the dedicated room. You can see the doffing room. And one more prerequisite here is that it requires the presence of a buddy who can be our staff nurse or can be any other person working in the ICU. So once you are in the doffing room, first procedure here should be to check if there is any soiling, any tears or anything. This has to be seen by the buddy, and also you can see it in the mirror to see if there is. Okay. Then if there is any soiling, buddy gives a wipe, alcoholic wipe, to wipe if there is any blood or any stain on the PPE. And that has to go into the bin which is dedicated for that. The major procedures will involve hand washing at all these steps. So there will be number of hand washing in this. So after the buddy has checked your PPE, this thing, now you disinfect your gloves with alcohol based hand wash. Then sit down on a dirty chair, a chair which is marked as dirty chair. You sit down on that and remove your shoe covers one by one. When you sit on this chair, the most important thing is that you don't cross your legs and gently pull it from the toes and put it into the bin one by one. After opening it, don't touch any other area. Just slide it, hold it from the distal end, pull it out, and then discard it. Disinfect the outer gloves. Again, now remove it after disinfecting without contaminating the inner one. Now just notice how it is being done. You just slide the glove out of your one hand, put it into the other hand, put it inside your palm on the other hand. Yes. And make a ball kind of a thing and slide the other glove over it so that you make one unit kind of a thing. And now this can be disposed of. This is the way to remove your gloves. Again, you do the hand washing of the hand sterilizing of the inner gloves. Now you can remove your face shield. Slowly. Yes, remove it and put it into the bin which is marked for goggles and face shield. Disinfect the inner gloves again. Remove your hood slowly after the hand washing. Yes, catch it from the top, slide it, open the flap, unzip it. Yes, hold it from the top. Yes. Excellent. And roll out your arms one by one. Yes, like that. Yes. Now remove your lower part from the leggings. Try not to touch your shoes. Yes. Make a roll out of it and put it into the bins, which are the red bins and specifically labeled for PPE kit disposal. Now do the hand washing, hand hygiene again. Remove the inner gloves. Same with the same procedure as was described before. Do the hand sterilization. Wear a fresh pair of gloves, sterile one. After the fresh gloves, now it is the time to remove your face mask. So what it is done, you keep a hand on the cup outside and then remove the lower one first. Remove the upper one. And now discard it. In the bin. Perform the hand hygiene again. Take an alcohol wipe. Sit down on the chair. Clean chair. Clean chair now. Disinfect your footwear. Disinfect and remove your gloves. Perform the hand hygiene again. Now you can exit the doffing area after stepping on a clean doormat which is soaked in hypochlorite solution. Now you can proceed to take a shower. So this completes the donning and doffing procedure as it should be done inside the ICU and other areas. If there are any questions, we can take those questions. We must understand that these procedures are very, very important. And why we are doing it? We are just doing it because the problem of Omicron is spreading. We are likely to see number of cases. Our healthcare workers are limited in strength, and we want nothing harm, no harm can affect the healthcare worker, because we are already suffering from shortage. And if we don't have proper training and this thing, they will also suffer. And remember, these people, if they suffer, they go to their respective houses and then can spread the infection to number of other people in the community. So that is why not only that their own health is important, it's also that they should not be a source of carrying the infection to other areas, because these are the areas which are potentially dangerous and can be one of the places from where the spread of disease can occur. So with this message, if there are any questions, then I will be able to answer them. Otherwise, this our talk about donning and doffing is complete. Thank you.
So till now we have seen how a donning and doffing is done once you enter into the COVID area. So once a patient comes to hospital, he should be made comfortable on a bed or trolley. And our first priority is to assess what severity of the disease does the patient have, so he's in COVID triage area now, and we will be assessing our patient. Dr. Praneeth and Mr. Narayan will be coming and assessing the patient, what severity of disease is there, and whether patient should be shifted to ICU, high dependency unit, or COVID ward, or he can be put in home isolation.
Good morning. I'm very weak. Dr. Praneeth is just coming in to see you. Okay, I'm very weak and I have fever. Feeling very weak and coughing.
Good morning, Donna.
Good morning, Dr. Praneeth.
Yep.
We have with us Mr. Ramesh. He is 70-year-old, coming from Sanjay Colony, Faridabad.
Yeah.
He is having fever and cough since 3 days.
Okay.
He has presented breathlessness on exertion today.
Yeah.
And he was tested COVID positive from outside.
Okay. So was it an rapid antigen test?
Yeah, it was rapid antigen test.
Okay.
It was positive from outside.
Okay. Thank you, brother. So good morning, Mr. Ramesh. I'm Dr. Praneeth from the Department of Medicine, and he's Mr. Mer Narayan, your nursing in charge in the triage area. So how are you feeling today?
Good morning. I'm very weak.
Okay.
And lot of cough.
Okay. Do you have any other symptoms associated? Are you having nausea, vomiting, pain abdomen, or diarrhea?
No, just fever and weakness.
Okay. Have you noticed any loss of smell or loss of taste sensation lately?
Yeah, I noticed some.
Okay. Do you feel that you're having some amount of chest congestion maybe or chest tightness while breathing?
No, it's not a chest pain, but I'm breathless today. When I started talking, it was very difficult and cough.
Okay, I do understand the situation. So, Mr. Ramesh, can you tell me, do you have any previous medical illness like diabetes or blood pressure or heart diseases maybe? Or do you have any previous surgeries that you would like to share about?
No, I don't have those.
Okay, so are you on any sort of regular medication before you got this disease?
No, I don't take medication.
Okay, that's good. Can you recall that, do you have any contact history with a positive patient, or maybe, let's say, you travel to a place outside?
My son is positive
Okay,
and he has fever.
okay,
He was okay at home.
okay. Are you vaccinated, Mr. Ramesh?
I've taken one dose 1 month back.
Okay, that's fine. So, Mr. Ramesh, we would like to get a quick general physical examination, if you don't mind, so that we can assess your condition and then we can start our treatment accordingly. Okay, so are you comfortable with that?
Yeah, please do. But I'm feeling very weak.
Yes, it won't take long. We'll just have a quick assessment of your condition. So I'll just like to start with your general physical examination. Can you look up a bit? Yes. Can you look down? So you can look at your icterus. Okay. You do seem to have a bit of congestion in your eyes. Okay. Your neck veins seems to be normal. Your neck veins are not engorged. Your respiratory rate seems to be fine. Can I just have a look at your pulse, please? Okay, your pulse is about 104 per minute. It is normal in volume and in rhythm. Mr. Narayan, can you tell me about his blood pressure, respiratory rate, and saturation?
Saturation is 94 on room air.
Okay,
BP is 120 by 81.
okay,
And the respiratory rate is 22.
okay. So, Mr. Ramesh, I'd like to do an auscultation just to hear your chest sound and heart sounds, if you don't mind.
Okay.
Mr. Narayan, can you help me with removing this? Okay, we are assuming that we have removed the shirt of this patient so that we can auscultate for the breath sounds. So, Mr. Ramesh, can you take deep breaths for me? Okay. Now I'd like to hear your heart sounds once. So, Mr. Ramesh, as of now, it seems that you're having a mild disease. Your heart sounds are normal. Your breath sounds are also normal. Your blood pressure is normal. You're maintaining a good saturation of about 94-95% on room air. He's maintaining a normal respiratory rate of about 23 to 24. He's not overtly dyspneic while at rest. So as of now, I guess we can categorize you to a mild disease. But since you are 72 years of age, you are an elderly gentleman, and you have noticed a bit of breathlessness while walking today, hence, to just keep a check on your progression of symptoms, we'd like to admit you to the COVID ward.
Excuse me, Dr. Pandit.
Yeah.
Do we need to have some blood investigation?
So as of now, we would like to order certain preliminary blood investigations like a complete blood count, a liver function test, renal function test. You had a COVID rapid antigen. We'd like to confirm that with an RT-PCR. A chest radiograph at this point will be good enough, and an EKG since he is an elderly gentleman. I guess these investigations will be good enough as of now. And as we have the days progressing, we can order for a few more.
So what will be the treatment advice for the patient?
For this patient, Ramesh, I guess we can start him on injection paracetamol, 1 gram IV SOS for fever. We can start with injection of pantoprazole. We can give him certain antitussive since he's having a vigorous cough, antihistaminics and multivitamins. So as of now, we would also like to monitor all his vitals, his regular pulse rates, his blood pressure, his oxygen saturation, and all this should be documented well in his bedside file. And I guess we can decide in the future what we need to change in these medicines. Okay, so Mr. Ramesh, do you have any queries that you'd like to ask us? Any questions in your mind?
Will I be okay soon?
Yes, Mr. Ramesh, you need to have that faith in you and faith in us and the system also that you will definitely be fine. So we'll be taking a very good care of you. We have an adequate amount of doctors and well-trained nursing individuals here in our hospital. So you will be fine. Any other thing would you like to
Thank you
ask?
so much. You are so nice, but I'm really afraid. It seems very dangerous disease.
Mr. Haran, we are keeping you in our hospital. We'll be taking a very good care of you. Now, there are certain findings that I'd like you to know. If you have these symptoms, which are suggestive of a progression of disease, you need to tell us. Firstly, if you notice some amount of breathlessness, which is increasing while at rest, or if you are feeling a sense of chest tightness, or let's say if you're having a very vigorous cough with your blood in sputum, or let's say if you're feeling a bit dizzy. So you definitely need to report all these symptoms to the doctors on duty and to the nursing in charge who are at your service in the COVID ward. Having said all this, I think you should do pretty well.
Can I ask you, can I meet my family?
Mr. Ramesh, unfortunately, in the COVID ward, that is not allowed because they're all infected patients here. However, we'll definitely make an arrangement for a video call with your families, and I don't think you'll be feeling lonely, and we'll be taking good care of you.
Thank you. You are very kind.
So thank you, Mr. Ramesh. I wish you all the luck. We'll be taking good care of you, and in a short while, we'll be shifting you to the COVID ward. Thank you.
Thank you. We are trying to shift you to the what?
Okay, so this was a general triage scheme that is followed in our triage of the COVID area. So here we basically divide the patient into 3 categories after a proper history and examination into a milder variety, a moderate variety, and a severe variety. But since Mr. Ramesh, there are 2 factors. First of all, though his symptoms appear to be mild, but yet he is a 72-year-old individual. So an elderly individual becomes an individual who can progress into sort of a severe form of disease. Hence, definitely, these patients or any other patients with comorbidities should be admitted in the COVID ICU for proper monitoring. Now, if you have any sort of questions that you would like to ask, we'll be happy to answer.
Thank you, Dr. Praneeth. It was wonderfully displayed about how we need to proceed. Can I ask you one thing?
Yes, sir.
How would have been our understanding and categorizing the patient? This patient would have changed in terms of moderate.
Yeah. So basically what will happen, I've told the patient few signs and symptoms, all the mild disease, whether we are keeping the patient in the COVID ward or we are sending them for a home isolation, they need to be told about few symptoms which are an indicator of progression of disease from mild to moderate, which include the red flag signs like if the patient is having a chest tightness or breathlessness, if the patient is feeling dizzy, or if we can see the patient is having or complaining of a bit of a loss of consciousness or palpitation. These are the signs which denote the progression of the disease. And once the patient is developing these symptoms, we need to be overtly cautious about the patient and probably shift him to a high dependency unit and order inflammatory markers which are denoting the progression of the disease.
Dr. Praneeth, I would like to ask you one thing.
Yes, ma'am.
Where would you like to shift patients with mild COVID disease, and where will you shift with moderate and severe disease?
So mild COVID disease, definitely in the COVID ward, or you have the dedicated COVID care centers available for these patients. Home isolation, the couple of requisites for the home isolation. Firstly, the patient should have a separate room, a separate bathroom. He should not have any other comorbidities. Now, in patients who have comorbidities like diabetes, those who are elderly, heart disease, they should have a low threshold for admission. So in these patients, definitely as compared to one who is 40 years of age, the criteria for admission the threshold for that will be a bit less. Now, in a patient who is having a moderate symptom, depending upon the facility which is available in our hospital, we can shift them to a high dependency unit or maybe an ICU. And if the patient is requiring an oxygen therapy or oxygen requirement to keep his saturation to normal, that we can take care of that and escalate the oxygen therapy accordingly.
Thank you, Dr. Praneeth. One more thing I would like to ask.
Yes,
if
ma'am.
the patient is RAT positive, shall we consider him as positive only and put him in a COVID area, or in triage we should keep him, or shall we send for RT-PCR? How should we proceed about it?
A RAT positive for all practical purpose, if the patient is having symptoms, we do consider him a positive patient. However, the gold standard of test is definitely an RT-PCR. As for this patient, he had an rapid antigen positive from an outside hospital. So we definitely would like to get an RT-PCR, and also in considering the present scenario, a genomic sequencing also, depending upon the travel history, is also advisable for this patient.
Thank you so much, Dr. Praneeth, for enlightening us about the triage of this patient. Thank you.
Okay, thank you.
Thank you, Mr. Nanarai.